Now let's learn about types of shock. First, we will see about hypovolemic shock. Hypovolemic shock so this is the most commonly encountered shock, and it occurs either by dehydration or hemorrhage. And when hemorrhage will occur, if it occurs during the surgery, and hemorrhage is of three types. Basically, it's primary, secondary hemorrhage, and tertiary hemorrhage. So what is primary hemorrhage? Primary hemorrhage is the hemorrhage which occurs during the surgery. Secondary hemorrhage, the hemorrhage which occurs up to 24 hours after surgery due to hypertensive state. So it is up to 24 hours. If hemorrhage occurs, then that is secondary hemorrhage after surgery, and it occurs due to hypertensive state. Then what is tertiary hemorrhage? Tertiary hemorrhage occurs due to infection. These infections setting up and eroding the surgical site, that leads to tertiary hemorrhage. So the tertiary hemorrhage occurs due to infection. And what's this infection cause? These infections setting up on the surgical side and erode the surgical side. So this infection setting up and eroding the surgical side, that leads to tertiary hemorrhage. So tertiary hemorrhage is always secondary to infection, and it occurs after a few days. It is always secondary to infection, okay? And hemorrhage may be of two types. It may be concealed or it may be of revealed. So what is concealed? Which we can't see, and revealed is which we can see. So concealed hemorrhage occurs in the body cavities like thorax, abdomen, limb compartments, etc. And revealed hemorrhage that we can see by our eyes. Now one more point to be added, that in head injury patient, we will never have a hemorrhagic shock like manifestation. Isolated head injury patient will never have a hemorrhagic shock like manifestation. So always we have to look for other areas of bleeding. Okay.